Hi, I'm Ellie. This is a quick video to take you through your practice report. This is where you'll see all of the data that has been submitted about both your NHS and private practice. You're asked to review this to check it's accurate and complete before it's published on PHIN's website.
To demonstrate how to use this report, I'm going to impersonate a gastroenterologist using a test account. Our consultant works at 2 sites privately and 3 NHS sites. So once I've logged in using the consultant's details, I'll click on Your Practice Report. This report is automatically filtered to show only private activity for the current publication period. That's the 12-month period currently shown on PHIN's website. If we want to change the period, we can do that here, but for now we'll leave this. To see our consultant's NHS data, we can click Data Source to include data submitted to PHIN by NHS Digital, and then Patient Type to include NHS patients. For the purpose of this video, we are going to focus on private data only, and so I'm going to click on Reset Filter. First of all, I'm going to have a look at their overview to check that things look broadly correct. I can see that the consultant works at 2 hospital groups privately. This consultant actually performs a lot more procedures in the second site, so we'll report the missing activity using the Report Data Issue button at the top. Once the form opens, I am able to choose which hospital site the issue relates to, and the issue we want to flag is inaccurate volumes and missing private patient volume. Once I've finished, I can click Submit to send that off to the hospital to review. Going back to the Overview tab, I can look at the discharges by month, and that all looks okay. Next, I'm going to take a more detailed look at procedures at each site. The overall numbers look right, but our consultant hasn't done a therapeutic sigmoidoscopy of the bowel. Therefore, I can click on this and I can see more detail on the funding source, age, and gender of the patient. If I click on the Detailed Episodes tab, I will see further detail on the admission, diagnosis, and procedure information. Our consultant recognises the episode, but the procedure seems to have been given the wrong code, so I'll report that. The form has already been pre-populated with the selections I have made on the report, so I'll just add a bit more detail and then click Submit. Finally, I'm going to look at the length of stay. We would generally see the median length of stay as 0 nights, as most of the procedures are performed as day case. A few episodes are 1 and 2 nights. This data all looks correct, so we won't raise an issue with the length of stay.
I have just demonstrated how a consultant would use their report to review the data that has been submitted about their practice. For the purpose of the video, we're focused mainly on private activity, but the consultant may choose to look at their NHS data too. If there are any issues in the data submitted by NHS Digital, this will need to be directly fed back to the NHS hospital. If you have any queries, please contact us on consultants@phin.org.uk.